So we'll go to the perioperative respiratory failure, which people don't talk about. The perioperative has been there a few years now, and the reason why people get perioperative respiratory failure, it's a balance between painkillers, depression of the respiratory system, unable to breathe because of the pain, and you get atelectasis, and you'll be shunting with atelectasis, no alveolar tissue. So atelectasis is the main issue here, because patients can't breathe. You give them too much narcotics, and they go into type 2 respiratory failure. So you get alveolar hypoventilation, type 1, type 2. So it's a combination of type 1 and type 2 respiratory system. And the causes of these, there are certain risk patients that anesthetists like to know about, and these are the risk patients who would develop perioperative supine position. You don't want patient to be flat, so you have to sit him up. Okay, that's one. Obesity, people get type 2 respiratory failure with obesity. Too much load on the respiratory system, as I said, compliance, too much chest wall to move, and that makes the lung work hard. Splinting of the diaphragm, what does that mean? It means the diaphragm is not working very well because of the operation. The worst operations that can splint the diaphragm is the thoracic operations, okay? So any thoracic operation, you can see them, they do splinting of it causes splinting of the diaphragm. And that's why in thoracic operations, they put lignocaine, when patients finish, they put lignocaine into the intercostal nerve so that patients don't develop pain. This has developed in Bradford, actually, and is now used all over the world. So, and for a day or two until the pain gets better. The abdominal operations, what are the worst operations that can cause splinting of the diaphragm? Abdominal operations. You got transverse upper abdominal, you got longitudinal. Which ones? The transverse upper abdominal is bad. So anything close to the diaphragm is bad. Okay? So transverse upper abdominal operation is bad. What about sternal cabbage operation? Is that bad or good? It's not bad, actually. All right, it comes lower down. Okay? So the further away from the diaphragm, you're okay. As you close to the diaphragm, you're splinting. That's when the anesthetists get very careful in anesthetizing these patients. Ascites, again, that can cause a problem. Age and smoking. Most of the patients who get cardiac operations and thoracic operations now have to stop smoking for 6 weeks because of the post-operative complications, secretions, infections, and all sorts. Then fluid overload. It doesn't happen nowadays because we have tight control on the fluid now. But in the past, people, like surgeons, operate on people and they give fluid 4 liters, 80 years old, and next minute they call you, he's hypoxic, and what's the problem? You do a chest x-ray and his lung is full of fluid. So you have to offload them. And then you get secretions. If someone is smoking, got COPD, get secretions, and you've got to clear it. Okay? And bronchospasm, obviously, got to give them nebulized bronchodilators. Any questions? So you treat these accordingly, and you have to look into all these causes.